This episode is brought to you by Intraprise Health, a health catalyst company. Make cybersecurity a priority, not a headache. Cyber attacks put patients at risk and cost healthcare organizations millions. But with convoluted software systems and risk and vulnerability data lost in silos, leaders know their organizations are vulnerable and they feel little control over the safety of their patients, reputations, or bottom line. Enterprise Health brings together cybersecurity experts with over 100 years of combined experience in healthcare to offer a comprehensive suite of innovative software and services. It helps leaders finally unlock a unified human-centric cybersecurity approach. With Enterprise Health, you can improve your cybersecurity posture, protect your patients, and simplify your employees' lives. Visit thisweekhealth.com/enterprise-health to find out more.
Today on Unhack the News.
At the end of the day, the person who is trying to do their job needs a level of protection.
Hi, I'm Drex, a recovering healthcare CIO and longtime cyber advisor and strategist for some of the world's most innovative cybersecurity companies. Now I'm president of This Week Health's 229 Cyber and Risk community. And this is Unhack the News, a mostly plain English, mostly non-technical show covering the latest and most important security news stories. And now, this episode of Unhack the News. Welcome to Unhack the News. I'm Drex, a longtime recovering healthcare CIO and now massively focused on cybersecurity. And my guest today is George Pappas, CEO of Intraprise Health, a health catalyst company.
Yes.
Welcome to the program. Tell me more about what's going on with you guys.
Yeah. Hi, Drex. Great to be here at Intraprise, as we've been on a mission for the last several years, making risk management more scalable. Because really the number one thing we saw in our clients, they have a lot of tools, but they can't really do risk management the way it needs to be done because of the manual effort involved. So we've been very busy in that. And we're very pleased to have met Health Catalyst a little while ago. They saw what we were doing and wanted to help us take it on a bigger stage. And so they became our corporate parent early in November, and we're thrilled to be a part of their organization. And we've got a larger customer base, a larger stage to accelerate our innovation because the market doesn't stand still. We just released our latest Blueprint Protect product with Gen AI for more automated third-party risk management. It's a real step function in how our clients can manage this portfolio of tasks that are almost so challenging sometimes they just don't do it. So we're really pleased with where we are and look forward to the future.
It's a real interesting overlap between the two companies too, because they have a customer base that isn't your customer base and vice versa.
Yeah.
Both customer bases have the same challenges and problems that both companies can solve. I was really happy when you called me and gave me the news. I think about the same time it broke publicly. I'm very happy for you guys. I'm glad you're in that spot.
Yeah, they're a great company, great people. Really pleased to be a part of the organization. Look forward to finding the right synergistic points as we're in the middle of doing that now. But I think we have a lot of good things to come.
Good. Great. Thanks for talking about that. I appreciate you taking a minute to do that. There's a lot of stories that we're going to cover today, a bunch of good stuff. The healthcare cyber legislation in the Senate, that looks like a lot of good stuff, even though we're in a lame duck session now, waiting for the new administration to come on board, new senators, new congressmen to rotate in and out. In my head, the curmudgeon in me says, I don't know that anything's going to get done. Are my assumptions wrong?
When I saw the bill, like yet another set of things that people believe healthcare needs to do. And clearly with all of the accelerated attacks this year, the irony is 405D, that project's been underway for a couple of years. So a collective group of industry and government people have been working on this for a while. First of all, even though it's coming out of the HELP committee, which is Health, Education, Labor, and Pensions, it was introduced by Senator Warner, who's chairman of the Senate Intelligence Committee.
And he's been the instigator for a lot of this stuff.
He's been a long time person calling out the problems of cybersecurity's patient safety, the vulnerability of our infrastructure. He's been really lighting it up the last couple of days over this telecom hack, which looks very deep and very wide.
Yeah.
Very embarrassing.
Yep.
And he was the original investor and founder of Nextel, so he understands cellular networks. He's got a tech investing background. So that was noteworthy. But for me, look at the attributes of the bill. It's very similar to what New York State did, very similar to a lot of the qualities that 405D had. Think about NIST 2.0 this year. They took what was really a more generic meta framework,
Mm.
added governance to it, but it still has very vague ways of measuring things. And HIPAA now, and part of this bill, by the way, was strengthening HIPAA because HIPAA is 1996. Yeah, it's been updated a few times, but clearly most of our colleagues in industry see HIPAA as the baseline. And now the industry is saying you better be doing a lot more.
Yeah, I love the
That's
HIPAA
what they're all
security
saying.
rule update that's coming. But like you said, HICcup, Health Sector Coordinating Council, we
Yeah,
just had all hands meeting last week, and we talked a lot about that too. That
right,
whole, how do you get people to continue
right.
to, over time, turn the volume up on their cybersecurity game?
Exactly. And when we look at it as being high trust assessors now, the first one in healthcare since 2011, you break all these frameworks down and they really have several similar qualities, right? What's the scope of stuff you're assessing, right? How
Mhm.
deeply are you assessing it? When you're actually assessing it, how are you ranking what's good, bad? What is good? What is bad? What is level 2 or level 3.6, right? What does that really mean? What are the missing areas? And then validation. I've always appreciated about the high trust method because it requires validation of procedural execution, right?
Yeah, that
But
ongoing
right,
checking, making sure you're still
right,
doing what you said you were going to do, and how are you going to
exactly,
do it a little bit better
right.
this week? Yep.
But HIPAA has no such requirement, nor does NIST. What does a CISO do of a 50-bed hospital? It doesn't have a lot of resource, but has 100 third parties.
Yeah.
Costs a little more money. That's why we're trying to scale our risk management capabilities through automation and talent. But ultimately, what all these entities are saying, and the New York law, I thought was the most pragmatic version of that, which they said, you got to report incidents 72 hours, you got to do all these things, and you have to validate. Okay, it's coming.
And in the New York state law, there's grant money, and
Yes,
not just one time, but over time,
yes,
money to get the program up and running and
right.
stable. Yeah.
Right, 500 mil. And in the regulation text, I thought was very interesting. Now they have to do this for state regulatory requirements anyway.
Mm.
They had an analysis by hospital size of how much they would need to spend within a range.
Right.
That was factored into their grant. It was factored into the startup cost versus the ongoing cost. So overall, I thought that was really powerful legislation that was needed. 250 general hospitals in New York. Now, interestingly enough, did not cover medical practices,
Mm.
skilled nursing facilities,
Mhm.
post-acute care. So that's the first kind of anchor. What's going to broaden out as we have an aging population and PHI all over the place and all these different pre and post-acute settings. It's going to happen. So the notice has been given. Cyber insurance carriers, we talked about this last time,
Yeah.
while pricing is leveled off, discernment of how you qualify has gone up.
Yeah.
Right. So
And the things that
they're
they'll
all coming to
cover
the
have
same
also
place.
gotten much more well documented.
Exactly. Exactly. So I think it's healthy. The bill was the latest version of that. It did have grant support. Hey,
Mhm.
Harry, come on now, buddy. He's helping me answer the
I
questions
see
here.
him back there.
It had the best practices, of course, coordination with CISA. I think we talked about this maybe a couple of sessions ago. Third party is not a isolated solution. It's a very broad solution. So the whole notion of software bill of materials, software quality standards, software companies basically notifying of breaches in a timely fashion, that's all going to converge and make doing this a little less daunting than it is now.
It's interesting, all of these things as they come up, there is a lot of overlap. I think to try to be an optimist, I think perfect is the enemy of good. And there's a
Yeah.
lot of good stuff in all of these. And ultimately, I think we just have to start somewhere. And that may be a
Yeah.
lot of different things that have a lot of
Right.
overlap, but over time, we can harmonize those things and figure out all that tweaking you're talking about. How do you figure
Correct.
out how to do the assessment and make sure that you're actually in the place that you think you
Mhm.
are? Maybe that can become one standard. But in the meantime, if you're in any other state besides New York, or Massachusetts, or there's a lot of those
Right.
kinds of things that are going on right now.
Right.
You should expect that the government's going to help you.
The other dynamic here is that we've been, as we do our work and build our platforms, have been really trying to drive to is
Mm,
while these frameworks have different nuances, there's a common set of things that they all try to do. So make sure that you can help a client do something agnostic
mm,
that is deep enough. So when a new requirement pops up, they're 90% of the way there, right?
yeah.
Or maybe even closer than that. And that's And from a board level perspective, because we do these calls with boards all the time with the CISO at the side, right? And they want to know that in a centralized way of good practice, good liability management, their organization is doing those things.
I'm going to switch to the next
Yeah.
story because we
Yeah.
could talk about this all day.
Yeah.
I know how we are. I know you're also excited about this story on the University of Utah
Yeah.
and Common Spirit building a clinical alliance to better support the patient base in the mountain region. Should we read anything between the lines in all of this, or?
I thought so. Here's what I really liked about it, though there's some ironies in here too, right? But what I saw in that, and if you combine that with what we're doing with interoperability, when people do disaster recovery or business impact analysis or other drills, like we've talked about,
Yeah.
they're talking about within their organization. I think that this is the first instance of resilience, meaning working with your, I'll call them competitors or regional substitutes, so that patients can still get something done if something happens and you happen to be going dark, because the alternative is you're manual, right? Or you're
Right.
shut down. And so in an era where increasingly we're talking about patient safety, patient access to care, if you have some prearranged privileges with your medical staff, technical interoperability with a backup copy that's kept separate, all
Mhm.
those things, I think I'd call it the hot backup of the 2020s, right? Because it's a way to let your patients still be served. Now, it's so interesting. You think about the healthcare business model and the economic structure we work within, and most healthcare entities want to have the entire patient life cycle within their kind of four walls, or within their four network walls, I should say.
Mhm.
And I think this is a good area where that's not true. And if
And
something,
network, you mean healthcare
yes,
system.
correct.
Yeah.
And so the irony, though, was that Common Spirit, as we know, had a very large attack late 22.
Right.
And because they were a combination of CHS and Dignity, 300 hospitals, how many different EHRs and EMRs, how many
Yeah.
different systems? Oh my
A lot of
goodness.
legacy stuff coming together.
So that's where the little Swiss cheese holes are everywhere.
Exactly.
And essentially, they bought a set of hospitals in Utah that allowed them to have this resilient setup with University of Utah. That's what made it possible. But I think it's a model that if HHS could do something about that, provide some incentive maybe, or some liability management, because across the entire country, you have areas where you have multiple health systems within a certain geographical distance of a
Mhm.
large set of populations.
Mhm.
And yes, you're going to be, I'll use the word competing, but at the same time, you've got to collaborate when your patients need help. And so I think it could be a really good way to do something here.
When you and I have been in CISO summits together, and the CISOs sitting there being very clear with each other
Yeah,
that cybersecurity is not one of the things we compete on. Everybody needs to be great.
exactly.
There's also a study, maybe came out a year ago, I think out of UCSD, and it was talking about San Diego specifically, the challenges of when a hospital has a breach in
Right.
any given market. The result is that healthcare quality that are not attacked goes down because of the rush of patients that come from those other facilities. So
Right.
that attack on a single organization in a market has a cascade effect on everyone
Mhm.
else in that market, even when they're doing their best. These wind up being overcrowded and emergency care jammed up. Yeah, another reason to build this in and plan for that flexibility should something bad happen to one of the hospitals in the region.
Because the way you just cited, it's about the continuity, the patient information. So if you can have the physicians already have privileges and be credentialed,
Right.
right? Now, one of the ways some of the cyber attacks happen is they disable the backup when they lower the boom, have another backup somewhere, because
Yeah.
HIEs tend to be real time. But with TEFCA, you have a common framework for liability management interoperability. I think that with a little bit of thoughtfulness, a little bit of bigger picture planning, a little assistance from some governmental agencies, you could make the system more resilient in a more meaningful way.
Maybe this will be part of new legislation in the next. Somebody will call you and ask you to help them.
I'm in Virginia. I'll go to Capitol Hill and have a chat.
Senator Warner staffers will call you and say, can you come over? Hey, the next story, this is one of those things that keeps coming up. For-profit and publicly traded company, that sort of space. But I hear a lot of folks talking about it now in healthcare too. And I don't know how much of it is fear mongering and how much of it is real, but that's professional liability insurance. There's a
Mhm.
story about that at thisweekhealth.com/news. And I'd like to hear your opinion about the story and the way this is playing out in the industry.
Yeah. And actually, let's start with the problem first, because over the last year and a half, there have been 2 or 3 CISOs who we've had conversations with, some of whom are clients, who are, rationally concerned
Mhm.
because they're not officers of the corporation. They're not covered by D&O, directors and officers, professional liability insurance. And as we already have covered on many of these episodes, they have very challenging circumstances. They have technology that is brittle and very vulnerable, lack of resources, lack of help. They're making recommendations to the board and getting half what they ask for. Their cybersecurity posture is not very good, right? Maybe it's improving a little bit, but how much? As we know, and we've seen documented evidence this year, what happens if you have an attack and someone dies or someone doesn't get access to care? Now they want to go find someone to go launch a legal action against. That person is vulnerable, right?
Mhm.
And the other irony I saw in that article, because there's another article that was out, I think just a couple months ago, that talked about CISO pay is going up because it's a tough job,
Mhm.
very challenging circumstances. Even if you had full resource and you had a great cybersecurity posture, if I could tell you it would never be hacked again, that'd be a $10 million request, right? If I could really do it, maybe $50 million request. You can't.
Yeah.
So at the end of the day, the person who is trying to do their job needs a level of protection. And there are a couple of ways to do this. We talked about this, I think, on our last episode. If that CISO reported to the CEO, they could be made an officer of the corporation,
Mhm.
right? They wouldn't need this. But if they're not, or a smaller organization, a community hospital that may not have a lot of D&O coverage, is a supplemental policy. But I think about the challenges that our clients have to deal with and the fact that hospitals, it's a tough operation. Healthcare is so complex and patients' lives are at risk. Yeah, I wouldn't take a CISO job in a hospital if I didn't have it because you've got to think about your family. You're trying to do the right thing here. So Crum and Forster, who's been out there with a lot of different coverage types, is the first carrier to do this. But I think it's a trend. I foresee riders to D&O policies you can get,
Mhm.
right? So it's the beginning of a needed change. When your earlier thought there about for-profit, the SEC has had a lot to say about that. That already it's Sarbanes-Oxley for CISOs in a sense, right? And then you have a lot of private organizations where their investors are requiring a level of cyber disclosure, but do they have the resource? Where's their security maturity?
Yeah.
Are you asking the CISO to attest to a level that you haven't given the resources to achieve? If they're telling I'll use the words, their view of what the real status is, that uncomfortable? That gets back to what we said last episode. If you don't have a relationship at senior leadership levels, how can you really be candid and be forthcoming when it really matters? And these
That's
are
right.
times it really matters. It's a challenging place to be.
There's one other thing in the article that I think is probably worth mentioning, and that is a lot of CISOs may have a side hustle too.
Oh, yeah,
You
that's
definitely
right.
want to have professional liability insurance if you're doing that.
Mhm.
If you're advising someone else, if you're coaching
Yeah.
someone else, make sure that you have that liability insurance on your LLC and have an
Mhm.
LLC. That might be another thing, right? If you
Yeah.
don't have a limited liability company that you're actually doing that work through,
Right.
you absolutely should do that. Those things are designed and built to protect your personal financial.
Yes.
I feel like a financial advisor right now, but
No, it's true though.
those LLCs are built so that the LLC is exposed. Should somebody
Right.
sue, they can only sue the LLC. And if you've got
That's why it's
insurance on
called
top of that, you're good to
LLC,
go.
by the way.
Exactly. Limited liability company. Man, there's a little bit of this that is just a little heartbreaking, I think, to
Mm.
see this. Again, I'm with you. I talk to these guys all the time. So do you. I know how hard the job is. I know how much they
Yeah.
struggle with what they would like to do compared to what they actually can do. And when you talk to them about not what literally keeps them up at night, but what
Mm.
are the things that they really worry about? One of the things they really worry about is this thing is going to happen and I'm going to feel bad because I
Right.
asked about that, but I couldn't get the resources for it
Mm.
at the time.
I
Money
mean,
flows
Drex.
freely once the event
Right.
happens. It doesn't flow freely prior to the boom. Keep good documentation.
Yes.
Make memo for records for yourself about conversation. This is a bunch of CYA. Look, this is the world we live in right now.
Yeah.
Make sure that you're keeping good documentation for yourself too, that you can go back to, and at the very least, be able to have notes that will remind you why and how you got to the place
Correct.
that you are. And that can be, again, super valuable should there be a legal case or a liability claim.
Yeah. It's a feature of where we are. Doctors have malpractice insurance, right? Hospitals have insurance. And one of the most important threats to the healthcare system over the last couple of years, that leader in that organization does not have a formal way to be covered for liability, professional liability. It's a little ironic.
Especially in today's environment.
Yeah.
Hey, thanks so much for being on the show today. I really appreciate it. George Pappas, the CEO of Intraprise Health, a health catalyst company. Really glad you were on the program. Always have a great time when you're here.
And by the way, I want to thank you. We've had a great year. Look forward to 229 CISO event in January.
Yeah, I'm psyched about it too.
Look forward to a great 25 with you guys.
2025 is going to be amazing. I will see you on the other side of the calendar page.
Yes. All right. Take care.
All right.
Bye.
Thanks for tuning in to UnHack the News. And while this show keeps you updated on the biggest stories, we also try to provide some context and even opinions on the latest developments. And now there's another way for you to stay ahead. Subscribe to our daily insights email. What you'll get is expertly curated health IT news straight to your inbox, ensuring you never miss a beat. Sign up at thisweekhealth.com/news. I'm your host, Drex DeFord. Thanks for spending some time with me today. And that's it for UnHack the News. As always, stay a little paranoid, and I'll see you around campus.